Good evening and welcome to the latest in the FCC Zoom event series. I'm Rebecca Bailey. Before we kick off tonight's event, I just want to flag some upcoming ones. Next Tuesday on Zoom, we'll be talking to the author Linda Jaivan about her new book on Chinese history. And if you're in Hong Kong at the beginning of September, we have a lunch meeting with the SCMP's political cartoonist Harry Harrison. But tonight, we're going to turn our attention to India and its response to the COVID-19 pandemic. The country's catastrophic second wave generated international headlines and unforgettable images as Narendra Modi's government struggled to cope with the full scale of the pandemic. Tonight, we're going to discuss how the pandemic impacted India's political scene, as well as its previously fast-growing economy. Were lessons learned? Can the country's finances bounce back? To answer these questions and more, we're very lucky to be joined by three renowned experts on India. Mihir Sharma is a Bloomberg Opinion columnist and a fellow at India's Observer Research Foundation. Devaki Nambiar is a program head at Australia's George Institute for Global Health, who has deep experience on Indian health issues. And Yamini Aiyar, the president of New Delhi's respected Centre for Policy Research, is here too. If you are in Hong Kong, this discussion is coinciding with a wall exhibition of photos on India's COVID-19 crisis. It's on the wall in the main bar if you needed any other excuse to spend more time there. But we've got a lot to get through, so I will hand over. Just a reminder, as usual, if you want to send in questions for our panelists, you can email question@fcchk.org. That's question singular @fcchk.org. For now, I'm going to hand you over to our excellent moderator, Bloomberg's Iain Marlow. He's also an FCC correspondent governor, and he spent many years in India, so he knows his stuff too. Iain, over to you.
Thanks so much. It's a pleasure to have all of you here with us tonight. I think we'll just jump right in. Yamini, I kind of wanted to start with you. This is all about the sort of lasting impact of the second wave on politics, economics, and health. And I kind of just wanted to start with you and talk about the political fallout of what we saw with the second wave. I'm wondering if you could maybe give us a rundown of how you think Narendra Modi's handling of the pandemic has impacted India's national political scene. And also maybe, we've seen some state elections since then. There's been a cabinet reshuffle. I wonder if you can maybe just give us a bit of a kind of rundown of what's happened politically since that second wave hit.
Thanks, Iain, and thanks for inviting me to this really interesting discussion, and looking forward to sparring with friends and colleagues on the panel. I think, look, to me, in some ways, the most visible political act of the second wave that ran through the month of April and May was the national government completely abdicating itself of all responsibility and trying to push blame, responsibility onto state governments. This has been one of the most important features of the current political regime has been its extreme push towards centralizing. India has always tended towards a far more centralized federal structure than most other federal countries. But we've seen over the last 6 years, 7 years, a far more politically centralized architecture that has emerged. And in fact, 2020 COVID response went completely the other way, where the central government, the national government, took on full political responsibility and sought to get full political credit for decision-making around COVID. And it showed up in two ways. There was a national lockdown announced without very much consultation with states, even though there was some overall broad political consensus back in March 2020 that lockdowns were the way to go, and various state governments had started moving in the direction of locking themselves down. But it was the sort of national government that took the call to have a national lockdown and was hoping to take full political credit for that national lockdown. Even when it came to the very limited and Spartan stimulus package that was was introduced in April and May last year, it was all done at the central level, even though there was a very strong case for this to be far more decentralized with the front and center role to state governments, because health is a state subject, social protection tends to rest firmly at the state level, and needs of state governments were very different, both on the basis of the nature of the disease trajectory itself, as well as the nature of economies across states are different, and the impact of the lockdown was felt differently across states. So you saw a very, very top-down national government approach where the center took steps to credit, because we also decided that by about December of 2020, India had beaten COVID. We were now going to develop our own indigenous vaccine. We were ahead of the game. We were going to be the world's vaccine manufacturer. All that credit was firmly going to be placed in the national government and in the Prime Minister himself. Once we got past the view that there's Indian exceptionalism and we had beaten COVID before anybody else did, COVID came back, and then the national government immediately moved away from taking any credit in the hope that there would be no blame on it as well, pushing responsibilities onto states when states actually were looking very much at the central government for support, and we needed this support, particularly as far as our vaccine policies were concerned. The abysmal failure of our vaccination policy has a lot to do with the fact that the national government washed its hands off. And what we saw, interestingly, was a political attempt to try and blame states. But I do think that the stain of the second wave hasn't completely disappeared from the national government, despite all attempts at doing so. We do see, at least there is some blame that has been placed on the national government. Whether that translates into into shifts in voter choices, it remains an open question. I very much doubt it, but that's because elections are complex games and there's many other things in play. But the disasters of April and May, both globally, blame was placed squarely on the national government despite all its attempts to blame others, as well as, I think, domestically, a sense that people were left without support from and leadership. It's there, and it's showing up a little bit in some of the surveys, popularity surveys to a degree. But the opposition and state governments have done very little, I think, to be able to mobilize and build on any potential sort of sense of discomfiture amongst the voters. And I think it's in that vacuum that ultimately the national government and the Prime Minister himself will be able to reclaim some of his popularity, which certainly did dent over the course of April and May.
That's interesting. I think observing Indian politics, it's always fascinating how many things Modi can kind of coast through, maintain his popularity. I remember demonetization and things like that a few years ago. Devaki, maybe just moving on to the sort of the health system aspect of this. I'm just wondering, many people watching now would have been familiar with the scenes and stories we saw out of especially around the peak of the second wave, people struggling for oxygen, hospitals running out of capacity. I'm wondering if you could first maybe give us a sense of, this is a broad question, but if you could first give us a sense of some of the relevant health challenges India's health system was seeing in the lead up to that second wave. And can you maybe talk a little bit about what has changed in Indian healthcare, if anything, since that second wave, since those images, shocked the world?
Sure, thanks, Iain. So I think many of us who've been working in and with the Indian health system have been lamenting its sort of shambolic nature for a while. And, we had been expecting an outbreak like this, a pandemic like this for many years. And, not nearly enough was done, certainly not at the national level, to address, to be in a situation of preparedness with respect to the pandemic. And there are three sort of key features of the Indian health system that are actually common to other low and middle income country settings as well, that sort of typify this. The first of these is insufficient public funding for health, right? So the allocation to the health sector in the first instance has been very, very poor for very many years, really 30, 40 years. And where it should be something in the order of, or at least even the National Health Policy says that by 2025, we should be allocating at least 2.5% of our GDP to health. The actual proportion has been somewhere around 0.9%, 1%, something like that. And so really what you're looking at is a public health infrastructure that's enfeebled and under-resourced in the first instance, right? And then so the calculus then becomes where health is a state subject for states to sort of negotiate with this paltry amount and try to set their systems up. So we were sort of failing there to begin with. The second feature of what we're calling this mixed health system syndrome is inadequate regulation or inadequate regulatory frameworks, particularly with reference to the private sector. And I think there also you could see the sort of price gouging and those kinds of things really running amok in the context of COVID in a larger sort of atmosphere of under-regulation of the private sector and even of the public sector for that matter, right? Regulatory frameworks that apply to all. So in that enfeebled state, you had a situation with COVID, for instance, where the decision of the administration was that we can have a free market logic for sales of vaccines, such that the Serum Institute can charge 150 rupees to the government to sell its vaccines for in those procurement arrangements, and for private hospitals it can charge 4 times that. Right? And the private hospitals can charge that then onward to the citizenry. And you're seeing just gross inequalities magnifying themselves, which you had seen, in other situations with respect to just care seeking in general, but really this becoming much, much more pronounced in the context of COVID. And then the final feature, of course, and I think Yamini's already spoken about this, is the sort of lack of transparency and governance. So, a very major concern about optics that seems to be really the mainstay, or perhaps that appears to be the guiding logic of decision-making. It's not entirely clear what the logic is of decision-making. And I think that has caused a lot of consternation. So for instance, high courts really trying to make decisions and guide decisions around, essential services, drug supplies, oxygen, vaccination, and really that being the force through which decisions are actually being activated in the public interest, right? Then also there's a lack of transparency, for instance, in how the public coffers are managed, how funding for PM Cares, for instance, is dispersed. It's not clear what the governing structure around that is and how that's benefited the citizenry in the context of the pandemic. And then also, I think there's been difficulty around even the use of evidence in decision-making, which is particularly frustrating for us in public health. For instance, there was in May, really at the height of the epidemic, the step down of a very, very eminent scientist from the Genetics Consortium of India, which is absolutely essential in terms of the understanding the nature of the pandemic and preparing ourselves from it. He did I think the New York Times editorial, and days later he had stepped down from this key body. And he was joined by many others in the concern over the lack of evidence in the decision-making process. So you see these 3 features really sort of amping themselves up in the context of COVID. And I mean, to me, and it's not so much, what has changed, but really what has not changed and how recalcitrant, some of these features of the health system have been and of governance have been. So I think that's what's really sort of quite grim at the moment. And even as we have what is probably a natural pause given the nature of epidemics and pandemics, we really ought to be redoubling our efforts, organizing, and if that's happening, it doesn't have public visibility, so it makes for a pretty, like I said, grim picture as of now.
Yeah, that does sound sound grim. Mihir, just on the economic front, I mean, obviously things in the Indian economy weren't particularly going so well before the pandemic hit, to say the least. Can you give us a bit of a sense of, and again, just kind of continue with a sort of broad survey of this, is of where the Indian economy was, in the lead up to the second wave. I mean, there've been some pandemic disruption, but not so much, I suppose. Can you give us a sense of what the sheer impact was of the second wave on Indian economic activity, both sort of formal and informal, has there been any, has it picked back up? I mean, has there been any sort of bounce back or anything since then?
Right. So I think that let's start off from something that you gestured at, Iain, which is to say that the economy wasn't doing awfully well even before the pandemic hit, and in fact, the first quarter of 2020, when the pandemic was just beginning to show signs of being what it eventually became, we had a growth print that we had GDP growth levels in that quarter, which I think 4 or 5 years ago we would have declared a crisis. So it was in the 4 to 5% range, and again, that was before the pandemic actually began to affect, before the lockdown, the national level lockdown that Yamini mentioned began to bite. And so we were in a bit of a situation last year, and I think that when we emerged from the first wave, when we began to see unlocking go through, there was a certain frantic desperation maybe at how both governments and businesses approached the process of unlocking, as we called it here. And there were lots of very I wish I could quote them for you, but there were lots of very optimistic views of how much India would grow in 2021, and even the Reserve Bank of India got into the act with some, with quoting Shakespeare about the winter of our discontent will be made glorious summer by the end of the pandemic, or something like that, and all that, so that was the sort of mental state that the country was in, whether it was the government, whether it was companies, or actual many citizens, when the second wave hit us. And it hit us, it took us, we took a long time to respond to the signs that cases are on the rise again, precisely because I think there was this level of expectation that we were emerging from the pandemic with this nice V shape, right? So A, we did really badly in the first wave. B, when the second wave hit, we were broadly unprepared for it, which meant that although we did not lock down nationally the way that we had in the previous year, we began to face very similar sorts of supply chain disruptions. And in a large country like India, local lockdowns, a patchwork of local lockdowns can have the same kind of effect on economic activity as an overall national lockdown. And finally, crucially, I think that you pointed out, and which is something that everyone has to say when they're talking about the Indian economy, what's the effect on the formal economy, what has been, and how is it distinct from the informal economy? And frankly, this has been a problem since demonetization, which also you referred to, which was now 5 years ago. We don't know half the time what's happening in the informal economy. We were really struggling to try and figure it out from other data points, from what, from surveys of maybe wages. There are now some private sector surveys of employment, but they're being attacked left, right, and center by the government, by activists. But we don't really know. Unlike in a lot of other economies, we have no real high frequency data. Whatever high frequency data we have is enormously biased towards the small fraction of the Indian economy that is formal. And the vast mass of people of India's workforce that work in the informal economy are generally not surveyed to the degree that we would like. And they are also, we are fairly certain, the people who are most hit by first the first wave, then the lockdown, and now by the second wave. the tragedy is that we are probably not going to know for the next 6 to 8 months exactly what the situation is in terms of employment and in terms of welfare on the ground, right? So that's the broader questions. To this, I have to add the fact that we now know that we're going to have a below normal monsoon. Well, we now think it's likely, according to most projections, we're going to have a below normal monsoon, possibly about 8% below normal. And of course, even in a good year, that would have had an effect on welfare and on growth. It's going to have a sort of cumulative effect this year. And finally, I think that we have to point to two sort of very problematic macro indicators. One is sort of that inflation has been nudging up against the RBI's tolerance level of 6%. It crossed it last quarter. It's just below 6% this quarter. And that's usually a signal that, in this case, it is a signal that supply chains really haven't recovered, and you still have bottlenecks at various points that are pushing prices up. And also it means that, of course, the RBI is going to find its hands a little tied when it comes to trying to support growth through monetary policy. And supporting either growth or welfare through fiscal policy is also problematic, because even before the pandemic hit, the government had run out of money. It just wasn't raising enough in indirect taxes in particular, as much as it had expected to. And therefore, we had run short of money by the time the pandemic hit last year. We did not spend a lot during the first and second waves, but even whatever we did spend, combined with the decrease in revenue that follows on from the decrease in economic activity due to the pandemic, means that we are now in a situation where for the foreseeable future, for the years to come, we are no longer a 60% debt to GDP country, which has given us a certain way of thinking about the world and about what government can do. We are a 90% or 85 to 90% debt to GDP country. We're more Latin America than Asian type. And that makes a big difference to what the government thinks and what the government thinks it can take on in terms of welfare, in terms of growth, and in terms of supporting Indian citizens through what will be a fairly problematic return to normalcy.
And you mentioned supply chains and the sort of crimping of this patchwork of lockdowns and different measures across the states. I mean, has there been a sense at all from the private sector? I mean, people talk about this in Europe and the States, particularly now, about companies building in resiliency, a word I think we've all heard too much of during the pandemic. But is there any sense that Indian businesses have adapted or would be able to cope with a third wave or anything like that?
There are two things that are interesting about the sort of business response to this. The first is that whenever things are doing badly for the macroeconomy, businesses in India cut costs. And they tend to actually sometimes show pretty good earnings numbers during downturns, because they see that as an opportunity to cut costs fairly heftily. So that happened in the 2013 downturn. It happened shortly after demonetization. And it sort of happened again at various points over the past 12 to 18 months. In fact, as I'm sure some of the people listening know, the Indian stock markets have been setting records for the last few weeks. And there is a disconnect between what the largest capital, the big cap companies on the stock market from the broader formal economy, and then again the broader formal economy from the Indian economy in general. Businesses in India were already resilient, because that's how you do business here. You never know, when your supply chain will run into trouble. You generally tend to have a certain amount of excess capacity built in. That is how you operate. You don't operate very efficiently. And when bad times hit, I think big business does better in India than it does in most other places.
That makes a lot of sense. Yamini, going back to you, I mean, among your many hats, are being commissioner and chair of the governance working group for the Lancet Commission on Reimagining India's Health System, You're also an advisor to the Punjab state government. I'm just wondering if you could give a broad sense of what sort of healthcare experts, governance experts are telling the government during this time. I mean, as you said, in your earlier remarks, not much seems to have changed definitively, but I'm assuming there's a host of advisors and other people suggesting policy changes, suggesting different routes they can take. What is the sort of chorus of advice that's cascading onto these Indian policymakers? What are they being told? Oh, sorry, I think you might be muted. Yeah, there, sorry.
Recognize the crisis that's staring you in the face and act. At this point, do something will be good, as opposed to hoping that fate and Indian exceptionalism will get you by. No, but I think in some ways, India was a little different so back in March 2020, a lot of the conversation was who's taking science seriously and who's not taking science seriously, keeping in mind the US and the Trump administration and how they were responding to COVID. I personally believe, and it's not necessarily a particularly popular view, but I think that the Indian expert community and our politicians took science a little bit too seriously without actually thinking hard enough, or whatever little science we knew about this massive unknown that was hitting us. And we didn't actually think hard enough about what the realities we exist in and live in. And we use the fact that our health system is broken to justify what I still believe was a completely unjustifiable national lockdown. It had widespread political consensus and it had widespread elite consensus that you would have ended when you switch off the button of the economy on an economy where the bulk of your workers work in the informal sector, casual labor, wage labor, and that you don't think it's going to have an impact on people. And you sort of try and weigh this as lives versus livelihoods when the two are so deeply intertwined. When you lock down at 500 cases and say, I'm going to do PPE kits, that's my health infrastructure, and try and figure out a little bit on testing. Yes, of course, there were all these unknowns, but we didn't do things in a way that actually recognized the realities of the consequences of actions on the vast majority of Indians. And it was visible within a week. We locked down, and actually days before we locked down, there was already a mass rush of labor, of workers from urban cities trying to make their way home. And then all our policymakers scratched their heads and said, oh yeah, we don't know actually how to count our migrant workers. That's why we don't really know what to do with them. And states started shutting down their borders, and we just left our people to walk home if they could, or die on the streets if they didn't. And in some retrospectively, we started opening the equivalent of soup kitchens to try and feed people. So I think actually we took expertise to build in a political consensus for a certain kind of action that may not have been necessary. The action that we did need was to say we have a broken health system, but in fact, when you commit yourselves to believing in the capabilities of the health system, India does have the ability to deal with epidemics. And Devaki will tell you better than anyone else how well we have dealt with some Nipah virus, H1N1. We've had these epidemics. Of course, COVID is different. Of course, there were many unknowns, but we didn't actually say, let's talk to our public health community, understand what we need to do in an Indian context, and build our system from the bottom up. We still haven't done that. If you look at the last budget that was announced in February, there was a lot of hogwash about a whole new restructuring of health. Devaki spoke about money. That what they did was that they took, some water and sanitation schemes, something from education, something from nutrition, threw it all together and said, now here's our 10-fold increase or whatever it was to our health budget. Actually, last year, what we spent, if you look at the extra spending that the government did after the lockdown, it was mostly on the National Rural Employment Guarantee Program, which was social protection, and only about 4% of it was on health, and a significant proportion of that came from the World Bank loan that we received to be able to deal with the COVID crisis. Since then, we have not increased health expenditure, and it's not just the national government. State governments too have not seen any massive shifts in their health expenditure or any. Mihir is right, 90%. We are at 90% debt to GDP ratio. The national government has consistently dramatically messed up its macro fiscal policies, and we are sitting on a fiscal crisis. We didn't have that much room for maneuver, but we were facing a crisis. That was time for creativity. We chose not to be creative, and we spent the bare minimum of what we had to prevent starvation, but we didn't invest in our health system. So we saw the second wave, we saw the consequences of the second wave. We still haven't invested in our health system. So all of us are actually like stuck records. We've been saying the same thing for decades now. The only difference was when I started out my career, I was not on the panel, I was listening. Now I'm on the panel saying exactly what I heard then too. And it's not because we don't have creative ideas, it's because there are basic things that need to be done. Those basic things mean, number one, a commitment to health expenditure, because we do need to spend to get good outcomes. Secondly, a commitment to believing in certain aspects of what the state has to do. We keep fighting about public and private in India, but if you don't have basic disease surveillance, that's pure public health. We have to say we need to do this and invest in it and believe in the ability of the state to do this, because no market will be able to produce these outcomes for you at any rate. And thirdly, we need to be able to recognize that we actually do have pockets of good practice. How do we build those, strengthen those, and scale them up and expand them? These are the things that we need to do in India. And above all, let's just start recognizing that we do have a crisis so that we can find answers to them.
Thanks for that. I was just going to say, for anyone watching who has any questions, you can email us at question@fcchk.org, and we'll try and ping it over to our panelists here. Devaki, just talk about what, following on from what Yamini was saying about sort of pockets of excellence. Obviously, India is a country of quite a few states that have different levels of capacity, different levels of development. Can you maybe talk a little bit about how the virus, either in the second wave or since, has impacted different parts of India? Obviously, the South has experienced a different virus than the North. I don't know if it's been very different in some of the, the mountainous states, the West and the East. Can you give us a bit of a survey in terms of what we know about the Indian context, what has worked, what hasn't worked, and if there's any lessons to be learned, as the country, sort of gets ready for what could be a third wave?
Sure. That's actually a really important question. It's a question, I think, as Yamini was saying, that we're not asking enough. So what has been happening in different states across the country and why? And let me just illustrate that. I had the good fortune of working in the state of Kerala for about 7 years now. And I've mentioned some of the examples from the state, including prior experience, really. Kerala has had to deal with Nipah, as Yamini was saying, H1N1, H5N1, flooding, all kinds of different sort of focusing events, if you will, that disrupt health services on the one hand, but require you to have your foundations right on the other, right? And in fact, in Kerala, just as recently as a couple of weeks ago, there has been an outbreak of Zika virus in Trivandrum, right? And so they're managing COVID and Zika together. And really, it's what are the indicators that we're looking at? Is it, there is, I think that there has to be a greater reckoning of that, because the fact that Kerala has the second highest rates of COVID cases is not perhaps the most important indicator to look at. How are those people making it through their diagnoses? Are they able to manage their conditions? The people who don't have COVID, are they able to get essential care services? What are the mortality rates? I think the challenge has been to even get the metrics right. In many states in India, you've been seeing people just trying willy-nilly to get people tested to keep test positivity rates low, right? To make the numbers look good. And I think there's been a lot of emphasis on looking good rather than why are things working in this way or the other way. And I think perhaps there needs to be greater emphasis on trying to understand what has happened. For example, again in Kerala, and I'll speak to some of the other states, there was some sort of at the height of the epidemic, the second wave of the epidemic, actually, a really sad plane crash that took place in Kannur in the state, and there had to be a massive sort of casualty management evacuation process with COVID protocols in place. And this took an extraordinary amount of planning, collaboration with local communities, and really kind of optimizing the foundations and the bases, the basic strengths that existed in the system in the public sector, which is very critical, and establishing key partnerships. No additional lives were lost in that whole evacuation process. There were some COVID cases, they were managed, everybody's okay. And as a result, there's actually now in the state an airplane crash management protocol for COVID, right? So there are some precedent-setting things that have happened in Chhattisgarh, for example. We make much of our sort of registration process for vaccination, and that is the cause of extraordinary exclusion in this country. It's an English-based platform, in a country where, just about 4% of the rural population has access to computers. Just about a third of Indians overall have access to this. Yes, our numbers are growing, but not to the extent where someone in rural India is able to register for this vaccination using a smartphone and frankly, jumping through a lot of the hoops that exist on this English platform, right? So in Chhattisgarh, what they did is they did away with the system altogether. They allowed people to walk in. They placed emphasis on registering people in hard to reach areas, tribal populations, the rural, the urban poor, and the rural underserved populations. And they actually got some flack for this from the central government, but really those are the things that have pushed up vaccination coverage rates in states like Chhattisgarh, and those are absolutely essential. We need to learn more about how that was developed, how it's faring now. In other states like Maharashtra, where some of the highest numbers continue to exist, there are pockets where there's been extraordinary management, of the epidemic. Some coverage has been, some attention has been given to the model, for instance, in Dharavi, one of the largest slums they say in the world, but certainly an area where you have really high density living. And the more we're learning about COVID and the need to manage COVID, there are lessons in places like that, certainly, about how to keep mortality down, how to keep the practices awareness levels high, and people's risk perception at a level where it isn't, sort of displacing economic activity, but it's also keeping people safe, and I dare say, I think this has been really uneven, and I think there has been some analysis, just to start off with, on sort of the political proclivities, and who is governing the different constituencies. And I think perhaps we do need to look at that more carefully. A recent study that was published on sort of slum ward leadership shows that the responses were very much shaped by their political allegiances, right? And a lot of their existing agendas in terms of making decisions in slum areas and so on. So there are some of those carryover legacy type effects in how people manage epidemics, and in many cases it's worked out to the benefit of the citizenry, and in others it has been quite cataclysmic. So we need to understand those examples better.
Is it the case yet that there's sort of the learning or the lessons are being tabulated at the national level, or are these certain kind of pockets where in Kerala they will continue to build on that legacy, and in Maharashtra they will, but that's not being applied nationally at the moment?
I think a lot of this is internal facing, Iain, and I think there's an opportunity lost in terms of national learning and exchange. And some of these platforms have existed. There are some institutional structures that are meant to generate these lessons and to help disseminate them. But those have actually been in abeyance, and that's attributed to COVID, at a time where that really should be heightened, where we have a bit of paralysis in some of those learning areas, and it's truly an opportunity lost. Perhaps there's hope, going forward now, but like even Yamini and Mihir was saying, are we using this time where things are not acute? Are we using this time well? I'm not seeing examples of that really quite yet. Some of that is on us. Of course. Yeah.
Mihir, can we maybe talk a little bit about the sort of business of vaccination here? I mean, it's obviously something that India got a lot of attention for in a time where, before the second wave, they're actually exporting vaccines, which I think some people, obviously there's a history there of playing a role in vaccine exports, but it was kind of surprising to people during the middle of a pandemic that India wasn't vaccinating their own people as quickly as they maybe could be. I'm wondering if you could maybe walk me through how India's federal government has sort of approached the regulation of some of the big vaccine manufacturers. There's been some confusion about not buying enough vaccines early on, banning exports at certain points, allowing them at different points. And then obviously exports crashed when the second wave hit. Can you maybe just kind of walk me through how the government's relationship with the vaccine exporters and producers has sort of unfolded over the course of the pandemic, and sort of what we can maybe expect in the future? Because there's an article today suggesting that they were going to maybe allow vaccine exports sometime in 2022 if they had vaccinated everyone by then, every Indian adult, which maybe not totally likely, but I wonder if you could maybe just kind of walk us through a bit of that.
Well, I think the relationship that the Indian government had with the big vaccine manufacturers is kind of emblematic of its general relationship with private companies, especially when it wants the private companies to do something for the state, which is that they assumed the companies would help out, but they didn't go out of their way to help the companies at all. So essentially what you had now, I mean, you can compare it to, compare the Indian government to that, totem of good management and efficiency, which is Donald Trump. What the Trump administration did, and as did a lot of other countries around the world, which was, you pre-bought a large number of vaccines for your people from the companies that you had access to, in order to essentially reduce their risk, allow them to make early investments, and scale up their own capacity so they could build what they needed to. The Indian government, in spite of having a fairly large pharmaceuticals industry, and particularly a vaccines manufacturing industry domestically, did not do that. And in fact, my favorite data point on this is that forget about doing it before the vaccines were cleared, before the vaccines were tested, as many other countries did. The Indian government, in fact, did not even write out a request for purchasing any vaccines until over 2 weeks had passed after the Indian health regulator cleared the vaccines, on December the 31st of 2020. So not till the middle of January did they even think about cutting their first check. Right? So obviously you are not going to have companies that are going out of their way to make their investments to start off with. Fortunately, you had at least one very big manufacturer, which is Serum Institute of India. And what the Serum Institute of India did was, it basically, in order to start ramping up production, did not depend on the Indian government at all. It went out, signed agreements with other governments, signed agreements with philanthropic organizations, COVAX, et cetera, Gavi, and built up its capacity with that money. And along comes the Indian government and then says, you have to break those agreements when the second wave hits us, right? So it's classic. Somebody else invested in our vaccine capacity when we did not. And when the time comes that we need it, we cut off exports, right? Now, what happens when we start looking at the distribution problem? So we've got, first of all, we've got maybe 1/3 of India's actual vaccine manufacturing capacity operating right now, because everybody else is waiting for Novavax, which Joe Biden is holding up because he's holding up the supply chain for Novavax to India. We're waiting for Johnson & Johnson. We're waiting for a bunch of things to do with indemnity, legal stuff, which incidentally was a scandal in the Philippines because they didn't get indemnity worked out until March or April this year. All right, that was a scandal. We haven't got indemnity worked out still, and it's not even in the paper. It's practically not in the paper. So there's a certain level to which I think, Indians themselves have to take responsibility for not pressuring the government. So we're using only 1/3 of our vaccine manufacturing capacity or thereabouts. Of that 1/3, which is now being used only within India, 1/2 is supposed to be bought by the government, and effectively the supposed breakup, we don't know for certain because the government doesn't really release these numbers in a timely way. 1/4 goes to state governments and 1/4 goes to the private sector. Now, the private sector idea was the following, which is that, look, we're going to let, this is going to be a very difficult vaccination program. We are not going to be able to get everywhere we want. We're not going to be able to operate at the scale we want necessarily. So why don't we ensure that the Serum Institute of India sells some of its output to private companies, which will then, inoculate their workforces, families, etc., etc. The problem is, of course, the Serum Institute of India doesn't want to go out and sell to everybody, right? They want to be able to sell to people with whom they have a pre-existing relationship, people whom they know will pay, right? Because it's not like the government is underwriting the private sector sales. So the Serum Institute of India is selling to large hospital chains. Okay, that's great. Now maybe the large hospital chains will go and invest in a distribution network. The government is not going to allow that to happen because it then gets stick for selling stuff to the private sector. So it tells the hospital chains, look, you can charge a maximum of between $2 and $3, 150 rupees as your service charges, right? That's what they did to start off with, which means that the hospital chains say, okay, we're being able to buy all this stuff from the Serum Institute of India, but each one of them is going to be really low margin for us. So tell me again why we're doing this. So, at every point, even when you introduce the private sector, you're basically quashing any level of innovation that they could do. It's not as if you're providing them with any security, reducing or mitigating their risk in any way. In fact, you're adding to their risk by randomly allowing, stopping them from exports, et cetera, et cetera, et cetera. So there is a dysfunctional relationship that the government has with the private sector. In this case, the damn vaccines are being built in the private sector, and we still have that dysfunctional relationship, and we've been underperforming throughout.
Do you think there's any potential? I mean, obviously, India had built up quite a lot of goodwill in the months before the second wave with its vaccine diplomacy. It was shipping millions of doses, not just around South Asia, but elsewhere. Do you see India's vaccine diplomacy picking up again, the exports picking up once the vaccination program in India has gotten a little bit more further along? I
mean, they're going to start exporting. They're going to export the AstraZeneca. They're going to export Novavax as and when we start producing it, and as and when it gets US FDA emergency clearance, and as and when Joe Biden feels it's all right to start releasing the crucial parts of the supply chain that he's not released yet. But the fact is that I'm not sure that if I was, running a developing country healthcare program, vaccination program right now, if I signed an agreement with either the Indian government or the Serum Institute, I would expect they would follow through with it. I think that even during the second wave, we should have at least ensured that the people who were depending on us for the second shot to first shots that we had already provided, that those people got it, right? And even, forget about everybody else, even Bhutan and Nepal, who are generally dependent on us for a lot of things, weren't had to come and basically hat in hand and say, where's our second shot? You promised us our second shot. People have been waiting for weeks. And so I kind of think that if we start talking about vaccine diplomacy again in 2021, there are going to be a lot of smiles, a lot of people nodding and tweeting, but we've lost a lot of credibility because of our behavior over the last 9 months, and I don't see why anyone, that credibility can be restored just because we start exporting again. I mean, yeah. I just want to, compare us, for example, to the European Union, which, although it was going through a fairly major wave earlier this year, kept on exporting. It honored its contracts, and we did not. And I think that was it's slightly problematic.
Yeah, that makes a lot of sense. Yamini, I'm wondering. I know federalism is a passion of yours, Indian federalism. I'm wondering if you can maybe talk a little bit about how India's relationship with its states, the sort of federal government relationship with the states, has influenced the way virus policy and the way the government sort of approached the pandemic? I mean, did the virus kind of influence center-state relations in any way? Was it the other way around? I mean, I know there's obviously a lot of sometimes hostile relationships between the federal government and the states. How did we see that sort of play out? And I'm assuming, it may have hindered more than helped in some ways, but I'm wondering if I can get your sort of perspective on that.
Well, mature federal countries have a degree of political maturity in their approach to deliberation, negotiation, and dialogue. And they also have institutional structures and systems in place to enable this. We have neither. We neither have the political maturity, nor do we have the institutional architecture that could enable deliberation and dialogue between center and states. And I think that that really hindered the overall response, both to the first wave, both to the national lockdown of March 2020, the first wave of June, July, August, September, and then the vaccine policy starting from January, and then the second wave, and in continuous of that, preparation for a third wave and response to the economy. What we saw was two things. I think we saw the further deepening of a politics of centralization, particularly in 2020, when the National Party took charge of matters that are genuinely state subjects and did everything within their power to actually disempower states from being able to respond effectively, particularly when it came to deploying its monetary and fiscal powers to empower states with financial resources that they needed quite desperately, especially in the first phase of the national lockdown, when the entire economy across the country had been switched off, and both health, dealing with the migrant crisis, everything was left solely with states. We enhanced borrowing limits after a lot of begging from state governments. State governments were asking for two things. One, they needed more unconditional support, fiscal support from the center, along with having the capacity to borrow more. We enhanced borrowing limits, but it took some time. And when we did, we also imposed a set of conditionalities on states to reform. So the national government decided that this crisis was the appropriate opportunity to do what the Indian elite like to say all the time: crises must become opportunities, and this is the time to do all those grand reforms that we've not done for the last 30 years, push them now when we had a economic slowdown, and now we've got an unprecedented crisis. So we try to use this as the opportunity to get recalcitrant states to do power reforms, labor reforms, so on, and some municipal government reforms, exactly the opposite of what you should do. I mean, some of them are perfectly okay reforms, I have no quibble, but this is not the time. At this point, states needed to feel that there was support from the center, and what we needed most importantly was a coordinated response, because one of the things that the national lockdown really showed us in stark ways, things that policymakers should have known all along, is that we actually have a very integrated economy. It's a national labor market, it's a national goods and services market. So the minute you switch off things, border issues start coming into play. People needed to move, goods needed to move. I mean, at one point in April of last year, agriculture, which is the only sector of the economy, ironically, that saw growth last year, the lockdown hit during the harvest season. And the state of Punjab had a serious crisis because they needed gunny sacks to be able to take once they took the harvest, to put the produce into the gunny sacks and get it to the markets for agriculture, for procurement were open at the time. But the gunny sacks are produced in West Bengal. There was no institutional mechanism for this negotiation to happen. So the chief minister of Punjab had to write to the chief minister of West Bengal. This is where, in any federal structure, the role of the center is interstate coordination. But the center had done none of that. It imposed on the states and refused to coordinate. And we had no institutional mechanism to enable that coordination. Cut to the second phase, when the central government decided not to take responsibility and said, actually, by the way, all of last year I controlled this when I should have given it to you guys. Now I'm going to give it all to you guys because health is a state subject. So even vaccine procurement for a while was left to states to figure out. States were locking down on their own, wherever, on the basis of what they saw fit, with a bunch of bureaucrats sitting in New Delhi coming up with complex and impossible to understand guidelines. But what you really required was a lot more coordination when one state is locked down and another is not, because we learned from last year that there are migrant labor from Bihar that may have landed up in Maharashtra and will now need to go home, or there'll be an impact on the remittances, et cetera, et cetera, et cetera. But there was no coordination. And so states became little mini despots on their own. And what we did see also is another very interesting phenomenon, which may have long-term repercussions in response to the economic crisis that is unfolding. You're seeing states now increasingly taking on a much more sub-nationalist, regionalist perspective on how to respond to the economy. So several states, in fact, came out with legislation saying we are going to reserve jobs only for people from us. So the nativist approach is coming in even in response to, which is, I think, something newer. It may all just be political rhetoric, but that political rhetoric has a way of finding its way into impacting how the economy functions. Last but not the least, what this has also done is completely break down any trust between center and state, and a large proportion of our states are now run by opposition regional parties and two by the Congress. And that means that the potential for deeper deliberation, which is needed, so take our goods and services taxes, we are coming up to a very crucial phase where the compensation that was promised to states, that period is about to close, and the next phase of the GST has to kick in, including very crucial structural reforms to the GST. That's going to be very difficult to do because the center used this as an opportunity to say, act of God. For a while, they try to withhold payment of the cess, compensation cess that was due to states, and then further went on to take on to basically on-lend the cess onto states rather than doing its job of fulfilling whatever promises it had made under the GST. So then you automatically create a political context then where it's going to be much harder to create trust, to do a lot of things that we need to do. All the key factor market reforms that we need to do going forward all require state buy-in. And what this has done is to deepen an already very fragile set of tension, relationship, and a lot of tensions between center and state. They've deepened, and we've done very little to build institutional systems. Even the GST Council, which was at one point hailed as a great example of cooperative federalism and an institutional innovation, is now a site for contestation, not deliberation and dialogue.
I think your description of the sort of frantic letter writing reminds me of the sort of annual letter writing contest from the Chief Minister of Delhi to the Chief Minister of Punjab over Delhi's pollution, and the blame game that always sort of happens once the pollution has already started and it's too late for anything to really.
No, and by the way, one of the things that my colleagues at CPR, when we started looking at the data on COVID, one of the things we realized is, I mean, this is spatial. Every part of India doesn't get COVID at the same time, right? So one very important way in which you can respond, you saw this happen in an ad hoc way in the second wave as well, is that there are certain sets of resources that are actually mobile. You can move them from one part of the country to the other in order to be able to be effectively responsive. Otherwise, you will end up when the surge recedes with empty hospital beds, et cetera, et cetera. So we need a lot of coordination, and actually you need that platform to ensure that those parts that are experiencing a surge can access resources, including doctors, nurses, and healthcare workers that are underutilized in places where you don't have a surge, and then after all, a lot of states were hoarding oxygen when Delhi was desperate, and they didn't release their quotas because there was no institutional structure in which you could actually build trust to know that if I release my quota today, when Delhi recedes and Punjab needs it, Delhi will actually give it to Punjab. So this coordination is also crucial just for COVID management, and we don't have it.
That makes sense. We're running out of time, but Devaki, I'm just wondering, given the way the virus has kind of come across India so far, I mean, the first wave was, I think, maybe milder than a lot of observers thought. The second wave was, particularly deadly. What can we say or guess or predict about what a third wave sort of might look like in India in terms of who it might impact, what areas it might, begin or start in? I mean, I know it's a sort of a bit of a vague question, but I'm wondering if there's anything we know that we could kind of predict about what a third wave might look like.
Well, Ian, I think what we've done is sort of not put the systems in place so that we would know one way or the other. So it works out that, I think the vitiation of trust that Yamini is talking about in terms of the state center and state relationships is critical here, because I think that would be key to any kind of preparedness that we would have for a third wave. And I think absent that, what we're left with is actually, informal efforts, community mobilization. And, that has been sort of very heartwarming, but also very ad hoc, so there are, religious institutions offering oxygen tanks, allowing you to sort of drive in and use oxygen, civil society organizations trying to support home-based management and things like that. So in my reckoning, I think the ability for civil society and for communities to sort of manage and handle the next wave has increased somewhat. But we don't know in particular what the nature of the next variants will be. So some of my epidemiologist friends have said that the Lambda variant is expected to be even worse than the Delta variant, right? And so what does that then bode for management? I mean, we can't then be relying on sort of the sort of goodwill and ad hoc organization of communities taking this on their own shoulders, right? What we need is to know what's happening, what is the direction of the epidemic in the first instance, through our public institutions, and then what is the response through cooperation between public and private institutions. And I think we really need to advocate a lot more strongly for that to even happen. We don't know the numbers, and we don't really know how we're going to respond either.
Yeah, thanks. I think we're basically out of time now, but I want to thank you all so much for your time. And one thing we do at the end of all of these sort of Zoom events is just go around and ask people for one book that they are reading at the moment that they could recommend to our audience. So if there's anything, it could be your own book that you've recently written. But can we maybe go around? Maybe Mihir, we'll start with you. If there's a book you're reading at the moment that you'd recommend.
I'm sorry to say that what I'm reading right now isn't a lot of fun. It's been sitting on my desk for about 3 years, and it's a book on monetary policy in India. So
no one's going to read that.
It's the Oxford monetary policy, but I'm not sure that any of these recommendations. So okay.
All right, thanks. Devaki?
So I picked up a book trying to get my thoughts together for this conversation, actually, and that was Giorgio Agamben's The Epidemic as Politics. And his work is really fantastic. This book, though, is just sort of a series of rants about what's been happening, not so much in South Asia, really, but I think it gives a frame to sort of look at the centrality of politics in epidemics.
That is more interesting than Mihir's. Yamini?
Maybe.
So I've just come back from a break. And on that break, I read A Gentleman in Moscow, which is far, far away from the world of COVID, and highly recommend it. It made the traumas of the last year and a half wash away. A little bit of gin and Gentleman in Moscow is a good combination. I highly recommend it. Then there's other serious books, but read Mihir's Monetary Policy if you're suffering from insomnia. Read Devaki's book if you want to feel depressed, and read Gentleman in Moscow if you want to come smiling back from a holiday.
That is an excellent recommendation, and I think I'll probably try and take that up. But again, thank you so much for the three of you for taking time out of your late afternoon there and joining us here at the FCC. I appreciate it.